In this presentation, I will discuss dwarfism in domestic dogs. I will discuss dwarfism in the German Shepherd dog, miniature poodles, Labrador Retriever, as well as dwarfism in recognized breeds. Dwarfism is a genetic mutation characterized by abnormally small stature or shortened limbs. Causes of proportionate dwarfism include metabolic and hormonal disorders such as growth hormone deficiency. The most common types of dwarfism, known as skeletal dysplasia, are genetic. Skeletal dysplasia are conditions of abnormal bone growth that cause disproportionate dwarfism. Chondroplasia refers to the skeletal disorder caused by genetic mutation that can affect the development of cartilage, leading to disproportionate limbs. There are over 350 recognized domestic dog breeds. Popular breeds like dachshunds and corgis are known and loved for their short stature and stumpy legs, a type of dwarfism. The American Kennel Club recognizes dwarfism traits as a primary requirement and a breed standard for over a dozen domestic breeds. Other breeds, like German Shepherds and Labrador Retrievers, are affected negatively by this genetic condition. I will further discuss the effects of dwarfism on different breeds. First, I will talk about a pituitary condition that causes dwarfism called pituitary dwarfism in the German Shepherd dog. Pituitary dwarfism is a rare condition of the underdevelopment of the pituitary gland. Due to this, there is a lack of growth hormone, thyroid stimulating hormone, as well as small body stature, stunted growth, and a shortened lifespan. This disease is brought on by a deficiency in the pituitary growth hormone, and signs of this condition are usually represented by 2 to 3 months of age. Previous research has found that the pituitary dwarfism in the German Shepherd dog is an inherited autosomal recessive gene. This occurs in 8% of the general population of German Shepherds. Symptoms of pituitary dwarfism in German Shepherd dogs: body is longer than normal, shortened legs, hair loss, lack of adult hair growth, breathing difficulties, swollen joints, swollen abdomen, bulging eyes, darkened skin, high-pitched puppy bark, and bowed front legs. Here is a picture of 2 German Shepherd dogs. This one does not have pituitary dwarfism. The one on the right does have pituitary dwarfism. Although both of these dogs are full grown, you can see here that this dog still has its puppy coat and very soft, fuzzy hair, as well as patches of hair on his knee and his hind that are missing. You can also notice bowing of the front legs, as well as the obvious size difference between the two. Dwarfism in miniature poodles is represented by a condition called osteochondroplasia, or OC. This is a medical condition that represents itself in lack of growth or misshapen bone or cartilage stemming from structural, metabolic, and endological causes. This is a crippling dwarfism that has been found in miniature poodles for over 60 years. OC is first apparent by the first 3 weeks of age. The puppies have abnormal movement, enlarged joints, flattening of the rib cage, and shortened or bent bones. Researchers at the Laboratory of Neurogenetics and Canine Behavior studied this disease and found that it is linked to a sulfate transporter. This research links a mutation of the SLC13A1, a sodium-dependent sulfate transporter, to a decrease in serum levels of sulfate. A survey of the miniature poodle dogs found that 5% of this breed is affected and 10% are the carriers of this mutation. Symptoms include stunted growth, abnormal movement, deformity in limbs, jaw, and rib cage, difficulties breathing, and difficulty eating. Dogs with less pronounced symptoms of OC can survive into the adulthood, but the majority have significant physical abnormalities and increased instances of osteoarthritis. As you see here, this dog in the front is affected by osteochondroplasia, and you can see the large rib cage as well as the deformity of the paws, as compared to normal paws and the deformed paws with this affected miniature poodle breed. Another breed that is affected by a form of mild dwarfism is the Labrador Retriever. This mild disproportionate dwarfism represents itself in shortened legs and abnormal body length and width. Several genes leading to this phenotype of short legs have been found. Research has found that the COL11A2 gene is strongly linked to the mutation. Research has also found that there are multiple variations of the COL11A2 gene, and it could lead to either partial to moderate deafness and severe skeletal dysplasia in the Labrador Retriever breed. Studies found that this form of mild disproportionate dwarfism in labs is inherited. As you can see in these pictures, all these dogs are, although the same breed, this one suffers from the mild dwarfism and has very short, stunted front legs, as well as a wider torso than the others. And you can see that this is affected in the bone of the animal. There are over a dozen domesticated dog breeds that have dwarfism or a form of as a primary breed requirement. Basset hounds, Dachshunds, and Welsh Corgis all have the breed-defining mutation of short legs. Based on a genomic analysis done by the University of California, Davis School of Veterinary Medicine, breeds like Basset hounds, Dachshunds, and Corgis do not share any recent common ancestry. However, they found a common haplotype surrounding the FGF4 retrogene in 19 short-legged breeds. The early ancestor of the chondroplasia breeds would have needed to carry both a source gene and a rare haplotype found in the retrogene. At least 12% of American breeds share this common phenotype and retrogene. This type of dwarfism is not known to cause any severe problems in these breeds. To conclude, domestic dogs are arguably the most diverse species of mammal, having extreme variation in phenotypes. Research about the causes of dwarfism lets us better understand the wide array of mutations that can contribute to it. This research provides incredible knowledge on the multiple mutations that can cause moderate to severe dwarfism in dogs. With better understanding of the genetic makeup of these diseases, it can help lead to the elimination or treatment for such ailments through guided breeding decision and genetic splicing. Here is the works cited where I got a lot of my information from. If you want to further learn about this subject, you're feel free to review any of these articles.